I'm Sangmin Lee. I'm one of the leukemia physicians at Weill Cornell Medicine at New York City. And I focus in treating patients with bone marrow failures, myelodysplastic syndrome, and acute myeloid leukemias. So this year I presented a presentation studying molecular serial monitoring in myelodysplastic syndrome patients. So we examined patients from the MDS Clinical Research Consortium who has had more than one mutation testing, and we examined what serial mutation monitoring may tell us about how the patients with MDS do. As you know, MDS, a lot of MDS patients do progress to leukemia, so it's important to look at how patients do with MDS. Our finding was that currently serial monitoring a mutation is not standard of care, so we wanted to examine what, among patients who had serial mutation monitoring, what the outcomes were. Our finding was that independent of age and IPS as risk factor for MDS, acquisition of new mutations on further testing was associated with poor overall survival, and more patients who acquired mutation had a transformation to acute myeloid leukemia. Now, serial monitoring of mutations is not standard of care, so we're currently further examining the data, and it is important to stress that currently it's not standard of care and we don't recommend monitoring for serial mutations, but this may evolve into an important testing for MDS patients. More importantly also, we're also examining role of serial mutation monitoring in AML patients at Cornell, and we'll be looking at similar outcomes in AML patients as well, and hopefully we'll have data pretty soon regarding serial monitoring in AML patients as well.